The next group is going to be presenting on mindfulness approaches, harnessing the power of the mind-body connection for chronic pain management.
Okay, good morning, faculty, staff, our fellow second years, first years, our family and friends. My name is Nadine Johnson, and I'm joined by my colleagues Hanna Kobol, Arubah Mansoor, and Sagda Ramadan. Of course, we would like to take a moment to acknowledge and thank our faculty advisor, Professor Richard Sable, for his guidance, support, and brilliant mentorship. We are so proud of how much we've learned from you, as well as our growth throughout this research process. And also, thank you, Dr. Burrington, for coordinating this series. So our topic today is harnessing the power of the mind-body connection for chronic pain management. So what is chronic pain? Chronic pain is recognized as pain lasting longer than 3 months that persists beyond the healing timeframe of a recovering injury. It is an occurrence that can affect people of all ages in multiple body locations with different types of intensities. It is multifaceted, affecting people biologically, psychologically, and socially. Therefore, evidence shows that a biopsychosocial approach is most effective in addressing chronic pain. Within the occupational therapy practice, mindfulness approaches integrating biopsychosocial factors can be used as a powerful tool for managing chronic pain by helping individuals develop a greater sense of control over their pain, reduce stress and anxiety, as well as improve function and well-being. We reviewed the current literature discussing mindfulness practices and found that common approaches to managing chronic pain included meditation, yoga, Tai Chi, and the Feldenkrais method, which is a mindfulness movement designed to re-educate participants about their bodies and improve their awareness through soft movements. Evidence shows that mindfulness practices have many benefits, including 1, participants who practice mindfulness meditation reported reduced pain intensity, decreased emotional distress, and improved quality of life. 2, the Feldenkrais method independently improved pain in participants who experienced cervical and shoulder pain, as well as chronic lower back pain. Next, yoga, in addition to self-management education, showed significant improvement in participants' ability to manage their pain, and they had less fear of attempting their physical activities. And lastly, Tai Chi was associated with improved musculoskeletal strength and joint stability, as well as significant reductions in pain intensity and improved physical function.
Okay. Moving on to our research question, how effective are occupational therapy-based mindfulness approaches in managing chronic pain in adults? Chronic pain is a pervasive issue that profoundly impacts individuals' quality of life, affecting their ability to rest and sleep, perform daily activities, engage in social participation, and often leading to significant financial burden. Mindfulness-based interventions have demonstrated promise in addressing chronic pain within a comprehensive biopsychosocial framework. By integrating those approaches with occupational therapy, we can offer a holistic approach to chronic pain management with a focus on enhancing functional abilities and overall well-being. To fully grasp the impact of mindfulness-based techniques on chronic pain and functional abilities, additional research is needed. Furthermore, exploring the potential benefits of integrating those methods with occupational therapy is essential for individuals dealing with chronic pain. Okay. Let's discuss our methods. The Easy Does It Chronic Pain program was conducted in collaboration with the Corpus Health Information Center. We enrolled 22 eligible participants and concluded with 10 participants. Participants were recruited through convenience sampling and voluntary enrollment. Our inclusion criteria consisted of participants' ability to utilize technology, their willingness to commit to 8 sessions, each lasting 1.5 hours, that was conducted through Zoom, and of course their experience of chronic pain. Exclusion criteria consisted of participants experiencing experiencing severe neurological disorders, cognitive impairments, and acute pain. Regarding the program structure, the study involved check-ins, education, mindfulness movements, and discussions. Study data was analyzed through SPSS and organized through Google Statistics. Oops, sorry. Research assistants handle recruitment, consent, assessment, and data collection for participants. For pre-test data collection, research assistants administered 2 pre-tests, including beef brain inventory, a valid and reliable tool for clinical assessment of pain, and the personal activity selections assessment, where participants selected 2 meaningful activities impacted by chronic pain and rated their perceived performance and satisfaction. For weekly data collection, participants received weekly session recordings, and research assistants conducted weekly check-ins, covering their pain, session benefits, and often participants how often participants practice mindfulness movements. Lastly, we conducted post-study interview responses, and post-study assessments were administered. Primary outcome measure included changes in pain, intensity, and engagement performance of self-identified meaningful activities that were impacted by their chronic pain.
Okay, so let's get into our objectives. While doing this study, our objective while doing this study was to really assess the efficacy of mindfulness approaches when in chronic pain management. As mentioned, we initially started off with 22 participants, but unfortunately for multiple reasons, ranging from personal factors to maintaining the study's validity, we concluded with a total of 10. All 10 of our participants fulfilled pre- and post-BPI and past assessments. Additionally, our research team collected feedback through weekly check-ins and post-survey subjective feedback. Taking a look at our data from the BPI assessment, we can see that it was evident that participants experienced a decrease in overall pain levels post-study and across various measures. This includes pain at its worst, pain at its least, average pain, and current pain levels. When viewing average participants' BPI questions pre- and post-survey, the results demonstrate improvement in how participants' pain interfered in their general activities and overall quality of life. Now moving on to reviewing the past assessment, participants' past assessment pre- and post-study responses were computed on a 10-point scale and averaged. The results indicated enhancement in both performance and satisfaction. Something to note, though, was when reviewing pre- and post data was the results demonstrated conflicting scores between meaningful activity number 1 and meaningful activity number 2. For meaningful activity number 1, the results suggested a significant performance improvement, but no significant change in satisfaction. In contrast, meaningful activity number 2 suggested a significant improvement in satisfaction, but then no significant change in performance following the intervention. So essentially, the statistical analysis for activity number 1 and activity number 2 resulted in opposing outcomes. So these outcomes for the past assessment will be further discussed in our discussion. In regards to collecting feedback, our research team collected weekly data on participant feedback and their experiences. This included the pain that they were experiencing and how beneficial they found the sessions on a scale of 1 to 10. We can see here how participants reported fluctuating scores of pain throughout the 8 weeks of the program, having both good and bad days due to instances of injury, sickness, and unforeseen events. Lastly, we have our post-survey subjective feedback. Participants were prompted to answer questions like what was helpful about the program and any recommendations for the program for improvement for future studies. Some feedback that participants reported included how they experienced increased movement awareness, especially in coordinating their pelvis and rib cage. Another was improvement in daily activities with an emphasis on stabilization and alignment, and how the program provided them a new perspective on body movement. Some recommendations for future studies and for future programs, creating printed handouts, publishing a weekly agenda to just clarify lesson goals and content, and considering extending the program for a longer duration of weeks and to be shorter duration of sessions.
Jumping into our discussion, let's first revisit the main objectives. Our study was primarily aimed at evaluating the effectiveness of a telehealth occupational therapy-based program which incorporates mindfulness-based interventions in managing chronic pain. The objective centered around assessing the impact of these interventions on participants' perceived performance and satisfaction in engaging in meaningful activities, alongside exploring overall experience of pain, considering both the physical and psychological aspects of chronic pain management. Now, interpreting our results. We noted that for meaningful activity number 1, there was improvement in performance. However, there was no improvement in satisfaction. This suggests that effectiveness of mindfulness approaches may vary based on the nature of the activities, especially those involving mobility and physical functions such as walking and running. Conversely, we noted the opposite for meaningful activity number 2, where participants demonstrated improved satisfaction regardless of no evident performance improvement. This suggests that the OT-based program using mindfulness interventions enhanced the participant's satisfaction by promoting a more accepting and compassionate self-view irrespective of activity performance. We also noted the importance of tailoring mindfulness interventions to individuals' pain levels, needs, and preferences through participant feedback and the variability in pain scores. Such individualized approaches have the potential to increase effectiveness and participant engagements. Overall, our research findings strongly support the core objective of occupational therapy, enabling individuals to fully engage in their daily lives. We advocate for the integration of mindfulness strategies within occupational therapy interventions, particularly for those managing chronic pain. Furthermore, we stress the importance of ongoing research to refine our interventions and explore innovative delivery methods. We propose occupational therapy-based telehealth groups, just like the Easy Does It chronic pain program, as a cost-effective means to extend therapeutic support to a larger population. Moreover, our findings underscore the vital role of occupational therapy in fostering mind-body connections, ultimately enhancing the quality of life for those enduring chronic pain. Lastly, despite a few limitations, overall, participant satisfaction highlighted the program's success in enhancing the significant role of occupational therapy's mindfulness-based interventions in promoting holistic well-being among individuals with chronic pain. Let's now delve into the limitations of our study. Firstly, we encountered challenges regarding incomplete survey responses. Factors such as holidays, sickness, and unforeseen circumstances resulted in gaps in our data, potentially impacted the overall sample size. Participant withdrawal also presented a limitation. Despite our efforts to retain participants, external factors led to some individuals withdrawing from the study, which can introduce bias and compromise the validity of our findings. Moving on to the methodology, our use of convenience sampling warrants consideration. While convenient for our data collection, it may not fully capture the diversity of individuals with chronic pain, thus limiting the generalizability of our study. Results: the duration of our program merits discussion. While our 8-week intervention provided valuable insights, it may not offer a comprehensive understanding of long-term efficacy of mindfulness interventions for chronic pain management. Understanding and acknowledging these limitations is crucial for contextualizing our findings and informing future research, demonstrating our commitment to advancing understanding in the field.
Okay. So overall, we drew 3 conclusions from our study. First, the Easy Does It chronic pain program demonstrated a significant decrease in participants' pain level. Second, participants reported improvement in their overall quality of life. And lastly, this study underscores the potential benefits of incorporating mindfulness techniques into occupational therapy practices for managing chronic pain, meaning that it offers an alternative to traditional medication-based treatments. So, now that we've completed our study, here are some thoughts for future research regarding this topic. Future research should explore the long-term effects of mindfulness-based interventions in occupational therapy on chronic pain management, since our study only evaluated the short-term effects of mindfulness on chronic pain. Future research should also investigate the effectiveness of mindfulness interventions on diverse chronic pain populations, and instead of just looking at mindfulness in an isolated context, also examine the integration of other complementary approaches with mindfulness and occupational therapy to identify synergistic effects that may further improve outcomes for individuals with chronic pain. And finally, develop and test hybrid models of service delivery that combine in-person and virtual sessions to increase accessibility and participant engagement. These are our references, and this concludes our presentation, and we thank you so much for listening. Does anybody have any questions? Does anybody have any questions?
If you don't, it's fine.
Yes, I have a question.
Alrighty. Our next group will present on integrating practical applications of emotional intelligence skills in the emotional intelligence curriculum.
Hi, good afternoon. My name is Alexandra Berman. I'm Ellenie Kuszer. I'm Parvina Rahimova. And I'm Ava Schiraldi. And today we're going to be presenting on our master's project titled Emotional Intelligence Curriculum, Integrating Practical Applications of Emotional Intelligence to Increase Transferability of Skills During Fieldwork. So this is our abstract. So our study aimed to provide students with evidence-based practical tips through Thomas et al.'s Emotional Intelligence Curriculum, also known as the EIC, that will facilitate the transferability of emotional intelligence skills to fieldwork and practice. Two practical tip videos were created and shown to our participants, demonstrating two EIC concepts: establishing professional boundaries with clients and supervisors, and managing emotions in clinical situations. Based on data from our pre- and post-test surveys, after viewing practical tip videos, participants demonstrated an increased understanding of EI concepts and their transferability in clinical situations. Participants reported higher confidence in implementing professional boundaries, handling disagreements, and managing body language and facial expressions. Participants rated emotional management strategies such as box breathing and reframing the situation most beneficial and transferable. So we had three objectives. Our first one is to assess the efficacy of adding practical tip videos to the emotional intelligence curriculum. Two, okay, they all say one, but two, to develop pre- and post-test surveys that assess self-perceived EI after watching the practical tip videos, so not only what we think, but what the participants thought themselves. And number three, to test the hypothesis that students' ability to understand and transfer the learned EI skills would significantly increase after the EIC practical tip video exposure. So our literature review, we looked at the importance of EI in healthcare. EI training helps students better assess their skills, decrease burnout, and manage emotions for improved problem solving in clinical situations. Developing EI skills enables occupational therapy students to better connect and build successful relationships with clients and establish client-centered goals. Regarding the transferability of our practical tips, which was a large portion of this project, Andonian discovered that EI training improved OT students' communication, expression of clinical reasoning, documentation clarity, and effective personal relationships during fieldwork level 1 and level 2. Regarding transferability again, to understand EI skills before applying them to high-stress situations, Kaifas et al. Introduced mock interprofessional scenarios, and after each, they provided practical tips for applying the learned coping mechanisms, thereby simplifying EI skills for better understanding. Furthermore, Gribble et al. And Polonio Lopez et al. Found that implementing practical EI skills training increased OT students' self-perception, decision-making, and emotional awareness. So regarding our methods, our participants were you guys, thank you. So our participants were SUNY Downstate OT students who began in May of 2022, crazy, and are expected to graduate in December of 2024, participated in the curriculum and pre-post test survey. 28 students completed the pre-test survey and 22 students completed the post-test, so therefore we used a sample size of 22 participants for data analysis. Regarding our methods, scripts for practical tip videos were developed and recorded. Participants completed the pre- and post-test survey with open-ended and Likert scale-based questions in a level 1 field work course. Thank you, Dr. Brandt. Participants engaged in the EIC videos, followed by their supplemental practical tip videos and a discussion. So for data collection, we used a pre-test and post-test survey that was then collected and analyzed. The practical tip videos were then edited to reflect the students' feedback. Pre- and post-test surveys were administered via Google Surveys, which was utilized to create quantitative analysis using pie graphs to assess students' emotional awareness before and after implementation. SPSS was used to calculate p-values to determine statistical significance. So where to access practical tip videos, you can search on the internet emotional intelligence at SUNY Downstate, and then in this section on the right, you can click on the video emotional management and the video friendly but not friends. So the results. Viewing practical tip videos caused a significant increase in participant understanding of these 3 EI-related areas. General EI knowledge and awareness. Participants portrayed a significant increase in understanding of EI concepts as student ratings increased from 46.4% to 63.6% with a p-value of 0.01. The amount of students that saw the value of practicing EI skills during fieldwork significantly increased from 78.6% to 90.9% with a p-value of 0.05. And lastly, 60.7% of participants agreed and 28.6% strongly agreed that a training curriculum involving practical videos and role play can enhance EI skills, significantly increasing. So for professional boundaries, implementing and maintaining boundaries, handling disagreements, and sharing personal information. For implementing and maintaining boundaries in the pre-test, it was found that only 10.7% of participants felt very confident in implementing and maintaining boundaries in a professional setting, whereas for the post-test, this significantly increased to 50% with a p-value of 0.01. For handling disagreements, before engaging in the practical tip videos, 35.7% of participants felt comfortable handling disagreements and conflict in a professional setting, and 28.6% felt somewhat uncomfortable, and which significantly decreased to 36.4% to comfortable. And then 9.1% felt somewhat uncomfortable in the post-test with a p-value of 0.01. And sharing personal information in the pre-test, 42.9% of participants reported that rarely shared personal information, 42.9% sometimes shared, and 14.3% often shared. In the post-test, this significantly decreased to 45.5% of participants reported that they rarely shared personal information, 31.8% sometimes shared, and 9.1% often shared, and 9.1% very often shared, with a p-value of 0.01. So we did pre-test and post-test questions that reflected each other. The first one in the pre-test was, how confident are you in setting and maintaining boundaries with others in a professional setting? With a rating scale of 1 to 5, 1 being not confident and 5 being extremely confident. And in the post-survey, it was after watching the supplemental practical tip video, Friendly But Not Friends, how confident do you feel to successfully implement and maintain professional boundaries? And then same, not confident to very confident. And in the pre-test, only 10.7% of participants felt very confident in implementing and maintaining boundaries in a professional setting, whereas in the post-test, this significantly increased to 50% with a p-value of 0.01.
So more results that were found: emotional management, body language awareness, expressing emotions, coping strategies such as journaling, reframing the situation, and box breathing. The amount of participants that were aware of facial expressions and body language during interactions after engaging in the practical tip video, this significantly increased from 46.4% to 77.3%, with p-value being 0.01. The amount of participants that felt comfortable doing emotions in professional settings increased from 7.1 to 40.9%, p-value being 0.01. In the pre-test survey, 25% of participants reported it very likely that they would use coping strategies such as journaling, meditative breathing, and reframing the situation, significantly increasing to 50% in the post-test, p-value being 0.01. After engaging in the practical tip video, 36.3% of participants expressed that the box breathing technique was the most valuable, followed by 31.8% for reframing the situation, and then 18.2% for journaling. So these are our pre-test and post-test questions and results for coping strategies. The pre-test survey question: when overwhelmed, how likely are you to use coping strategies such as journaling, meditative breathing, and reframing the situation? Rate on scale of 1 to 5, being 1 unlikely and 5 being very likely. So 28 responses were there. And for post-test survey results, after watching the supplemental practical tip video, emotional management, when overwhelmed, how likely are you to use coping strategies such as journaling, meditative breathing, and reframing the situation, 1 being unlikely and 5 being very likely. So in the pre-test survey, 25% participants reported it very likely that they would use coping strategies such as journaling, meditative breathing, and reframing the situation, significantly increased to 50% in the post-test. After engaging in the practical tip video, 36.3% of participants expressed that the box breathing technique was the most valuable, followed by 31.8% for reframing the situation, and then 18.2% for journaling. So these are the results table. So we have run our pre-test and post-test results through SPSS, and we got this table. This result shows that there was a significant correlation, p-value being 0.05. These are some of the limitations that we have faced. One being the constraint of time and resources, specifically sample size, poses a challenge. In order to determine stronger effectiveness of the practical tip videos, numerous cohorts would have to complete level 1 and level 2 fieldwork. Potential disparities in facilitators' experiences with specific scenarios affects the accuracy of scripts for experiences they may not have navigated. Because the facilitators are graduate students, they have had limited clinical experience. Therefore, some of the practical tips were taken from prior experiences, while others were based on prior students' feedback. With 28 participants completing the pre-survey and only 22 participants in the post-survey introduced potential biases that required considerations. A technical issue with the slow-speed box breathing technique video impacted the evaluation of the effectiveness of this strategy. Conclusion. We came up that this research significantly advances OT education by addressing practical emotional intelligence application and transferability of EI skills, paving the way for future investigations into optimizing educational strategies, enhancing practitioner preparedness, and promoting effective transferability of soft skills in healthcare settings. Despite the outlined limitations, these implications offer a roadmap of educators, researchers, and practitioners to continue advancing OT and fostering the development of emotionally intelligent, competent healthcare professionals.
Okay, so now that we finished our study, in terms of next steps, this research advances OT education by providing students with practical emotional intelligence tips that can be easily transferred into level 1 and level 2 fieldwork experiences. Our project emphasizes the importance of having transferable EI skills to enhance practitioner competency, confidence, to strengthen the client-centered care and practitioner-client relationships, while ensuring a smooth transition from academic setting to practice. This research offers a roadmap for educators and practitioners to optimize educational strategies to foster the development of emotionally intelligent, competent OTs. Future research will also aim to provide practical tips and applications for more EI concepts in the EIC, or Emotional Intelligence Curriculum. So the impact of the curriculum is that it's currently being marketed and used nationwide by other programs, which we'll show on the next slide. Emotional intelligence skills are relevant to all healthcare disciplines, not just occupational therapy. It's a research curriculum that's going to be continued to be developed by future cohorts at SUNY Downstate. So here are some programs that are currently using the EIC or have expressed interest in using it. So as we see, there's some master's programs using it, OTDs, OTA programs, there's a PA program that is using it, and also even a high school, showing the necessity of these emotional intelligence skills and how important it is to have them. So we would like to thank Dr. Thomas for her guidance, encouragement, and continued support. Dr. Brown, thank you for letting us conduct our study during your fieldwork seminar. Sean Nurse for helping us upload our videos to the Downstate website, our peer supporters, and our entire cohort for participating and giving us great feedback to help grow this curriculum. Any questions? Thank you.
Yes, I have a question.
Sure.
Thank you for presenting this information. I'm curious if you've had any feedback from all the sort of universities that may have used it, or even your own peers in terms of implementing those practical tips on level 1 fieldwork that you just completed. I'm curious if you heard anything, particularly in challenging or conflict situations.
Yeah, so the reason we started this study by adding practical tips is from the feedback of prior cohorts and universities. Sorry, guys. They said while it was great, these concepts are a little abstract and hard for students to understand sometimes. So we brainstormed and we came to the conclusion that adding practical tips and making these concepts a little more concrete by giving specific tips would help break that down for a larger scope of learning abilities. So that's the feedback that we got from most universities.
Thank you.
Yes, Bethany?
As someone that participated in the study, when we were watching the videos during fieldwork seminars, it kind of came off like funny. We just didn't take it like super seriously, but I have to say during fieldwork, I actually learned a lot from your videos, as I just want to say thank you. And just to add on to Dr. Newer's question.
Thank you. We're happy to help.
Thank you. Our next group will be presenting on introducing healthcare disparities in gender minorities, study in an occupational therapy-based program.
Okay. Good afternoon, everyone. The title of our master's project is Exploring Healthcare Disparities in LGBTQIA+ populations in an occupational therapy program. My name is Rebeca Gonzalez, and my pronouns are she, her, and hers.
My name is Peihwa Ni, and my pronouns are she, her, and hers.
And my name is Rosemery Nunez, and my pronouns are she, her, and hers.
And my name is Tiara Varela, and my pronouns are she, her, and hers.
And our faculty advisor is Dr. Tribble. Okay. I first wanted to define what the letters of LGBTQIA+ mean, along with some examples of common pronouns that are seen on the right side of the screen. L stands for lesbian, G stands for gay, B stands for bisexual, T stands for transgender, Q stands for queer or questioning, I stands for intersex, A stands for asexual or ally, and the plus stands for all other non-cisgender and non-straight identities. Let's begin with a bit of background information about the LGBTQIA+ population. In 2022, the statistics of the population in America goes as follows. 57% identifies bisexual, 21% identifies gay, 14% identifies lesbian, 10% identifies transgender, and 4% identify as others. The LGBTQI+ community faces barriers in healthcare caused by stigmas and discrimination that result in mental and physical disparities. This results in poor healthcare services leading to social isolation and mental health difficulties such as anxiety, depression, and mood disorders. Causes of these stigmas are due to lack of proper education, comfort level, and personal exposure in healthcare workers when treating gender minorities. Despite other healthcare disciplines taking strides to eliminate or reduce these LGBTQIA+ healthcare disparities, OT has shown little research in explaining an adequate educational structure that incorporates LGBTQIA+ topics across educational programs. The first task we completed was a systematic review of literature, which came back with 4 major themes, with sub-themes included under each. The first theme discussed was barriers in training instructors on LGBTQI+ content, with the sub-themes of lack of instructor knowledge on LGBTQI's health concerns and time constraints. The research literature explained how there was not enough time to teach the new information along with the designed course curriculum. The second theme discussed was LGBTQIA+ health education content in health profession programs with the sub-themes of terminology and cultural competency. Regarding terminology, research explained the importance for medical students to understand relevant terminologies to avoid any miscommunication or use of inappropriate language. The third theme discussed was methods of integrating LGBTQIA+ content in health courses for instructors with the sub-themes of case studies, group discussions, lectures, and video clips. Research literature explains that lectures, including case studies, discussions, and video clips, were common effective teaching strategies used when implementing material about LGBTQI+ healthcare disparities. The final theme discussed was an increased need for LGBTQI+ education and occupational therapy programs with OT involvement as the only sub-theme. Now, Tiara will discuss the purpose of our study.
Okay, so the purpose of our study was to conduct a pilot test assessing the effectiveness of integrating LGBTQIA+ content into occupational therapy curricula to promote inclusion through diverse teaching methods, aiming to enhance educator competency via a collaborative approach. Okay, so the goal of the project is to reduce healthcare disparities and stigmas for the LGBTQIA population by implementing LGBTQIA health content into an OT graduate program through various teaching methods, and to equip a New York licensed OT instructor to teach within a course to prepare culturally competent future OT practitioners. So we developed 2 research questions to investigate what the barriers were to implementing this content and which teaching methods approaches were most effective and most commonly used, since there weren't enough structured forms of teaching this material in the literature review research. So to begin our study, an inclusion and exclusion criteria was formulated for selection of the participant. The inclusion criteria consists of different requirements needed for eligibility, such as the professional requirements including occupational type. So our participant had to be an OT professor, and they also had to have a New York registered and licensed occupational therapy professional background. And then they also had to have clinical and educational experience of at least 3 years, and we considered demographics, language type, so English preference, speaking professor, technological accessibility, capability for content integration, and teaching approach requirements. And then the exclusion criteria just states the opposite of the inclusion criteria, which emphasizes restrictions to participation and eligibility. And I would just like to emphasize, just like the last bullet, so a professor who exhibits any bias, discriminatory, and racial beliefs towards the LGBTQIA+ population or teaching about the population is excluded, because of course, we want to reduce the amount of healthcare disparities that are ongoing in this time. And so within our methodology, we conducted a qualitative research design exploring a single case study, and our participant was one New York licensed and registered occupational therapist with 25 years of experience working in psychiatry and 17 years as a clinical associate professor, so he was more than qualified to be within our study. The first meeting was two interviews with open-ended questions, and 2 collaborative meetings were held on Zoom, with the interviews being manually transcribed through Google Docs. The first meeting was a preliminary interview comprised of 9 questions that gathered information regarding the participants' teaching and clinical competencies, experiences with LGBTQIA+ content and patients, and potential challenges related to project participation. After a course overview of the participants' weekly lecture topics, a second meeting was convened to deliver an informative PowerPoint presentations with LGBTQIA content from evidence-based research with inclusion of current statistics, data on LGBTQIA+ terminology, pronouns, and mental health topics such as depression, anxiety, and mood disorders, specifically bipolar disorder, stemming from health disparities and stigmas faced by the LGBTQIA+ population. A follow-up third meeting provided inclusion of adjustments made into the participants' original weekly lectures, integrating the relevant and correlating LGBTQIA+ topics and teaching methods proposed during the second meeting. This aimed to align and merge with the participants' lecture structure and teaching style. A semi-structured interview was then conducted during the fourth meeting to evaluate the impact on knowledge and comfort resulting from the provision of the LGBTQIA content and to facilitate dialogue regarding whether the collaborative process adequately equipped the participant with the necessary tools to teach future OT cohorts effectively.
These are the preliminary interview questions designed to evaluate the participants' knowledge, confidence, and comfort in their role as an OT practitioner, particularly regarding interactions with LGBTQIA+ clients' patients. It also explores whether they have integrated or taught LGBTQIA+ content previously as an educator and addresses potential challenges and solutions related to participation in the study. The semi-structured interview evaluated the effects of collaboration on participants, assessing changes and increases in confidence, knowledge, and comfort levels. During the final interview, we emphasized our goal, which involved questions to promote discussion on whether the teaching methods and LGBTQIA+ health content sufficiently educated the participant about the population, enabling them to feel prepared and equipped to teach it in future occupational therapy courses for upcoming cohorts. The transcription was analyzed where frequency themes were formulated. 5 themes were found with 9 sub-themes as displayed in the chart. Results in this project were transcriptions from semi-structured interviews. The results were then analyzed into themes. The results shown in the themes are knowledge with sub-themes of terminology, statistics, prior knowledge, and pronouns, themes of methods in teaching with sub-themes of case studies, PowerPoints, video clips, and presentation, theme of confidence, theme of challenges with sub-themes of time constraint and difficulties in adjustment of quality of information, and then finally the theme of organization of content. The results of this project show the participant had prior LGBTQIA+ knowledge and teaching experience, boosting confidence. However, time constraints prevented integration of LGBTQIA+ content into the participant's current course due to the quantity of content he is required to teach. The changes pre versus post collaboration demonstrated significant importance in developing the best strategies for incorporating LGBTQIA+ content into their course. Overall relevance, OT has begun to show research on developing educational structure within the field in efforts to reduce healthcare disparities in the LGBTQIA+ population.
Now I'll be discussing the limitations. So the first limitation is sample bias. The recruitment was done through convenience sampling. So this is a technique where selection takes place due to easy access and availability of the participant. And in this instance, selection wasn't based on the participant being the most representative of the entire population, which can influence the validity and reliability of the results. The second limitation is sample size. As we mentioned, we collaborated with one participant, so the sample size affects the validity and reliability of the results as well. The third limitation is time constraints. As the group members excluding the participant, there is a process of finding, adding the information to the existing slides of the course and collaborating. So this takes time, and we had to schedule all the meetings where all were in attendance. Also, the participant is currently a clinical associate professor at 4 different institutions, and also a senior occupational therapist in a psychiatric unit in a hospital in New York. So we had to take that into consideration as well. The fourth limitation was methodology errors. As we mentioned, the data was collected manually, so by doing this, you have to consider the possibility of human error when transcribing. We also have to consider the effects of formatting of the questions. They were long questions, and when we were conducting the interview, we realized that there were similarities with the questions, so there is a possibility the participant may have felt that the questions were repetitive. Also, the questions were asked verbally. It might have been useful to condense the questions and have it in writing because there were times that we had to repeat the question to them. The main findings of the collaboration are that we concluded that the participant hasn't implemented LGBTQIA content due to current quantity of information in the course and time constraints of teaching the course content. And the best methods of teaching were determined as case studies, PowerPoint presentations, and video clips. The suggested content consisted of terminology, pronouns, current statistics, and also how OTs can address their involvement within the LGBTQIA population. Lastly, the collaboration was successful in improving the participants' knowledge by helping them find where and how to implement this content and potentially use this for future cohorts. A direction for future studies are implementing LGBTQIA plus health education into other OT courses using various teaching methods, such as the ones emphasized during this collaboration, and strategies to increase exposure. Replicating the project by facilitating a longitudinal study to increase opportunities on how to incorporate the content throughout other OT courses, and increasing cultural and clinical competency. And lastly, possibly developing an evaluation assessment for data collection using quantitative surveys. As we mentioned, this project had qualitative data collection, and these surveys will measure the OT students' competency, effectiveness of implementation, and in return, this information will expand OT literature. And these are our references. We want to thank Dr. Tribble and also Dr. Bruntain for supporting and guiding us during this entire process. And we also want to thank our audience, you guys, for listening. Do you have any questions? No?
Oh, we have a question.
From the nature of the topic, like how might, oh, a microphone. Is that better? Yeah, everyone can hear me? From the nature of the topic, how might you minimize, or how have you considered how you might minimize like the trauma to maybe the researchers as it can, you might get, like you had that criteria of eliminating people who are racist. But if you got that comment, how might you keep yourself emotionally safe?
I'm sorry, I couldn't really hear.
Damn it, I have the microphone.
Just the noise out there.
I'll try
without what you asked.
That's better? All right. How would you minimize trauma or maintain your own safety? Because you had that exclusion criteria of people who are biased or sexist or racist and all that. If you did come across that content while researching, how did you protect yourselves?
So I believe that the whole part of the exclusion criteria was in particular to selecting our participant. So if during the preliminary interview that we conducted with the participant showed any evidence or signs of any racist comments or any negative comments towards the population or beliefs, or maybe the implicit biases and explicit biases were being shown, then that would have actually shifted our whole study and the selection of our participant. So I think we would have just rerouted and turned to looking for another participant at the time. So in that way, we would have protected ourselves as a group and protected the information of the study as well.
Yeah. Sometimes if you come across too many, it's death by 1,000 paper cuts.
That is true. That is true, yeah. So, I mean, that's just all, communication, taking into consideration who we are selecting as well. As we said, it was a convenience sampling. So, yeah, we did have a little benefit just to the convenience sampling method that we used.
Okay, our last but certainly not least presentation, our students will present on the effectiveness of COTAD chapter events in developing cultural competency.
Yes. Okay, good afternoon, everyone. My name is Marion de la Peña.
My name is Yazmine Bernier.
And I'm Jenna Gargano.
We're going to be presenting about our study on the effectiveness of COTAD chapter events in developing cultural competency. And before we begin, we'd like to thank our incredible advisor, Dr. Nancy Klein, who is a phenomenal professor, clinician, OT researcher. Thank you for your guidance and mentorship throughout the entire process. And thank you to Dr. Brewington for coordinating the course. Okay, so to begin, we'd like to cover what exactly cultural competency is and its importance in the occupational therapy field. According to the US Census, the minority population is projected to increase by 54% in 2060. Given these trends, it's more important than ever for healthcare professionals to develop cultural competent practitioners to treat diverse patient populations. The CDC defines cultural competency as a set of congruent behaviors, attitudes, and policies that come together in a system, agency, or among professionals that enables effective work in cross-cultural situations. Cultural competency guides occupational therapy practitioners to effectively provide client-centered care that can lead to optimal patient outcomes, which is a core value of the profession. Therefore, it's imperative for occupational therapy students to start developing cultural competency early in their didactic learning. In our literature review, we investigated what the healthcare field has done to increase cultural competency of clinicians and students. Within the healthcare profession, large healthcare systems have implemented diversity, equity, and inclusion workforce development and translator services in numerous languages. Studies have indicated an association between DEI workforce development and patient satisfaction, while translator services have been linked to better health outcomes for individuals of culturally and linguistically diverse backgrounds. As for academia, OT programs have developed international service learning programs, as we learned from our first group today, where students have the opportunity to provide OT services to underserved communities in countries abroad. As evidenced in our literature review, significant efforts have been made to increase the cultural competency of healthcare professionals and students, but the literature does suggest for more data on student intercultural development and implementation of experiential learning opportunities in OT programs. So based on our findings, we were determined to analyze the effectiveness of experiential learning programs at SUNY Downstate, such as the COTAD chapter events here at Downstate. The COTAD chapter is a student-led organization that hosts service learning programs and intercultural events that promote justice, equity, diversity, and inclusion, and which are hosted throughout the academic year. Which leads us to our research question. Does COTAD chapter events increase the cultural competency of Downstate OT students? We hypothesized that downstate OT students who participated in 2 to 3 COTAD chapter events would score higher than downstate students who only participated in standard course curriculum on the Cultural Competence Assessment Instrument, also known as the CCAI-UIC. So first, our materials and methods. Our participants, before we go into details, we'd like to thank the first and second year downstate OT students who participated in our study. Give them a round of applause. This study would not have been possible without your participation. So first, we sent out a recruitment email to all first and second year downstate OT students, followed by a pre-CCAI UIC and qualitative survey before the first COTAD chapter event during the first week of the fall 2023 semester. After the last COTAD chapter event, we also sent out a post-CCAI UIC and qualitative survey during the last week of the fall 2023 semester. Now next on our materials and methods, COTAD chapter events. The COTAD chapter hosted 4 events during the fall 2023 semester, consisting of 2 service learning events as pictured on the right. First was the Downstate Community Health Fair, where COTAD members volunteered to provide health promotion to the Brooklyn community. And the second service learning event for the fall 2023 semester was Backpack Awareness Day, where COTAD members volunteered to organize and execute presentations and workshops about safe backpack use for school-aged children in local public schools in Brooklyn. And lastly, 2 intercultural events. The first was a Hispanic Heritage Month event, which was an interactive celebration consisting of food and music, while COTAD members educated students about Hispanic culture and how to provide culturally competent care to Hispanic clients. And lastly, the Cultural Holiday Potluck event, where students shared holiday delicacies from their cultures, and COTAD members educated students on how to provide culturally competent care for clients who celebrate Christmas, Hanukkah, and Kwanzaa.
Okay, so for our materials and methods for the pre and post survey tools, the CCAI, as seen on the left side of the screen, is a quantitative measurement tool that utilizes 3-factor model with cognitive, behavioral, and contextual components to measure cultural competency amongst rehabilitation practitioners who work with individuals with disabilities from a diverse population. We chose the CCAI as our quantitative assessment due to its strong reliability, sound psychometric properties, and validation by occupational therapy practitioners. The CCAI helped quantitatively assess if students who participated in COTAD chapter events displayed a stronger understanding of cultural competency compared to students who only participated in the standard occupational therapy course curriculum. As seen on the right side of the screen, we have our 5-question survey that asked participants if they attended any events, what motivated them to attend events, how confident they felt regarding their cultural competency, and how these events affected their overall cultural competency. So for materials and methods, the Pearson product moment correlation is a coefficient that is measuring the linear relationship between 2 variables that have been measured on interval or ratio scales. As seen on the chart on the left, there are 2 types of strength associations, positive and negative correlations, and then within that, there's small, medium, and large correlations. And it was used to examine the relationship between these 3 samples: first-year students with first-year students who participated in COTAD chapter events, first-year students with second-year students who participated in these events, and first-year students with second-year students who participated in these events. For our quantitative results, for the chart on the top right, the number of OT students that attended COTAD chapter events was shown in the pre- and post-surveys. For the pre-survey, which was the summer semester, there was a higher attendance rate of second-year students for the Juneteenth event, accessible yoga event, and the Eid event. As for the post-survey, which was conducted in the fall semester, there were higher rates of attendance for second-year students at the Downstate Community Health Fair, Backpack Awareness Day, and the Cultural Holiday event, whereas more first years attended the Hispanic Heritage Month event. And the results indicated that there was an increase in COTAD chapter event participation for first-year students in the fall semesters and consistent participation for second-year students during the summer and fall semesters. So continuing with our quantitative results, as seen in the table on the right, results showed that there was a negative relationship between first-year students with first-year students who participated in events and first-year students with second-year students who participated in these events. And there was a positive relationship between second-year students with second-year students who participated in these events. The results of the Pearson R value from the CCAI were beneficial in determining if COTAD chapter events increased the cultural competency of downstate occupational therapy students. For our qualitative results, the participants' motivation to attend COTAD chapter events were similar in both pre- and post-surveys, as seen in Table 12 here. For individuals who were curious and had a desire to learn about different cultures, results remained at 77%. For individuals who had a desire to give back to the community, results increased from 39% to 42%. For individuals who were required to attend for professional and academic purposes, results increased from 19% to 39%. And lastly, for other reasons such as supporting peers and getting to know other classmates, results decreased from 23% to 7%. Continuing our qualitative results, as seen in Table 13, the results of OT student ratings on their cultural competency on a scale from 1 to 10, 1 being the lowest and 10 being the highest, in pre- and post surveys indicated that students rated their cultural competency above average. The average rating was 7.54 for pre-survey and 7.58 for post-survey, indicating a 0.4 increase in the post-survey. And as seen in Table 14, the results of participants' confidence in interacting with individuals of different cultures increased from 90 to 95% between pre- and post-surveys. The last of our qualitative results, 4 themes emerged from the analysis of the responses of how COTAD chapter events increase cultural competency of participants. Increased confidence to serve diverse populations, increased knowledge of different cultures, better understanding of the local community, and contrary views on the impacts of COTAD chapter events on cultural competency. And alongside with that, we have a couple of themes that were provided, student testimonials that were provided for the table on the right to support these emerging themes. And one quote from this was, "COTAD chapter events have given me insight into specific aspects of different cultures, like holidays and cuisines. This will help me design therapy interventions that utilize this knowledge to better build rapport with my client and help increase treatment adherence."
All right, good afternoon, everyone. Let's take this thing home. So for our discussion, our objective, again, was to understand the impact of COTAD chapter events on occupational therapy students' cultural competency. So for the interpretation of our results, the pilot data from pre- and post surveys revealed a diverse student population with varying levels of cultural competency training. Qualitative analysis showed student-led events as interactive and effective, though some students did suggest improvements. Weak to moderate support was found for the hypothesis that 2 to 3 COTAD chapter events improved CCAI UIC scores, indicating a need for further research. So we have our comparison to other studies from our lit review. Our literature review aligns with findings from Brown and Stav and C.O. DiFrancesco et al., emphasizing that service learning programs boost cultural competency in occupational therapy students. Morell, further supports occupational therapy students to start their careers with high cultural competency self-assessment. All right, so for our limitations, we had a couple of limitations with our study. We did have a small sample size. It only consisted of 60 first and second year students who participated, which causes difficulty in generalizing findings to other occupational therapy student populations, such as larger programs or programs located in rural or international settings. The study was a short duration. It was conducted over a short period of time, and there will be need for a long-term research to fully grasp the continuous impact of service learning projects on occupational therapy programs' cultural competency. There may have been desirability bias from our participants to present positive attitudes towards cultural competency, which could potentially impact our post-assessment/survey outcomes, and then past participation in COTAD events. Previous involvement in COTAD events may have influenced students' interest in cultural competency, which again may impact the post-assessment/survey outcomes. And then for the sampling, again, it was a convenient sample. We used a convenient sample of downstate OT students. Thank you again, everyone, which again may cause limitations in generalizing findings to broader populations. All right, our conclusion and for future directions. The main finding of our study, The study assessed effectiveness of COTAD chapter events in developing cultural competency among first and second year downstate OT students. The pilot data collected using the CCAI, UIC, and a qualitative survey indicated that students who participated in COTAD chapter events showed higher levels of cultural competency compared to those who followed only the standard occupational therapy course curriculum. The hypothesis that participation in COTAD chapter events would lead to higher scores in the CCAI, UIC was then confirmed. So as far as direction for future studies, we want the future studies to continue to contribute to the growing body of evidence supporting the integration of cultural competency training and OT education. They should explore the long-term impact of intercultural and service learning events on cultural competency development. They should develop strategies to maximize the effectiveness of intercultural and service learning events. They should address the limitations identified in the study in the previous slide to enhance future research outcomes. And then they should integrate cultural competency education within the classroom and service learning together, which will hopefully lead to a greater outcome than service learning or classroom learning alone. And that is all. These are our references. Thank you. And if anyone has any questions for us? No? Great. Thank you. Thank you.
Okay, so this concludes the research portion of today's agenda. I would like to thank the Advanced Learning Resources Center and the Office of Communications and Marketing for their support of today's program. I would like to thank the faculty and staff and guests for your support of our students and our program. Your guidance and encouragement have been invaluable, and we are grateful for your continued commitment to excellence in occupational therapy education. We are inviting you to please join us in the atrium for refreshments and to review the students' accompanying posters. Before we go outside, students, I'm going to ask for you to meet on the steps for a group picture as well as faculty, and we will resume our program at 1:45 with the white coat ceremony.